Hi, I'm Erin Bluth. I'm a registered nurse and childcare health consultant with Aspire LLC, here to talk to you today about RSV and give a brief guide for childcare providers. First of all, what is RSV? We know that it's a virus. It causes common cold symptoms in most individuals. It's very, very common. In fact, it's one of the most common illnesses in early childhood. For some individuals, like young children under the age of 2, older adults, and individuals at high risk for severe illness, it can cause very, very severe disease. It is spread by, or AKA modes of transmission, it's spread by respiratory routes. So those are droplets, which form by someone coughing, sneezing, talking, and those droplets can travel about 3 feet in the air and then fall to the ground. From there, someone can have contact with those contaminated objects or from contaminated hands. So if they've coughed or sneezed into their hands, or if a child has put their hands into their mouth and then touches other objects, they can then spread that virus from one person to the next. The virus also spreads through direct contact with respiratory secretions. So that would be direct contact with saliva, mucus, which in a childcare setting and in the classroom, sometimes it happens that we get someone's saliva and mucus or snot on our clothing, and that is one way that the virus can transmit from one person to the next. Symptoms of RSV are very general. Most people experience just runny nose, congestion, and a cough. The cough can sometimes linger for up to 2 weeks with RSV, but most people, again, experience very, very mild symptoms. In infants that are young, they may experience irritability, poor feeding, lethargy, which is it's just a term for excessive drowsiness or unusual lack of energy. They may also experience apnea, which can be scary because that's brief periods where they stop breathing. They can also experience some cyanosis, which is a blue tint to their skin, and usually it's around the mucous membrane, so usually around the lips or the gums, and this can happen typically after like a coughing spell. Of course, those would be triggers for us to notify the families and then recommend that the child be evaluated by their healthcare provider. The contagious period for RSV is a little tricky and it's hard to pinpoint. It starts about 1 to 2 days before symptoms begin, and it can last anywhere from 3 to 8 days after symptoms start. Some people a little shorter, some people a little longer. Very, very young infants can be contagious for 3 to 4 weeks. So we don't really know exactly when someone's contagious when they're sick with RSV, which then brings us to our next point. How do we control it? It makes it really, really hard if we don't know someone's contagious to know how we can stop the spread. And there's a few tools that we have. One, we can wash our hands with soap and water often. That's children in our program, infants, toddlers, preschoolers, school age. Everybody should be washing their hands with soap and water as often as possible. And there are some techniques that I can share with you for those very young infants. Teachers and caregivers should be washing their hands with soap and water often, frequently throughout the day. Soap and water is preferred, but if you don't have access to a sink, with running water, hand sanitizer is acceptable, but you want to take some precautions for children. And of course, you don't want to use hand sanitizer for children under the age of 2. We also want to make sure we're practicing proper respiratory etiquette. So covering those coughs and sneezes, throwing away those used tissues, and of course, following that up with washing your hands with soap and water as soon as possible. We also want to make sure that we're following routine cleaning, sanitizing, and disinfecting procedures for all of the classroom materials and all of the childcare surfaces. You can find those recommendations on Caring for Our Children at nrckids.org. You can also contact me at aspire.com if you have any questions. If you'd like to learn more about controlling the spread of illness and managing illness outbreaks, I can provide virtual training and workshops. I can help with policy development and implementation. Or if you have any other childcare health and safety questions, again, please contact me through aspire.com.